Hi, good evening, everyone. Good evening, everyone. Am I audible, Mr. Varun?
Yeah. Dr. Archit, you're audible,
Yeah,
sir. Since you're the guest
Okay,
speaker,
Thank you, Varun. Thank you so much.
please turn your
Thank you,
video on,
Mr.
sir.
Vinika.
Since
Sorry,
it will be great if you can turn your video on because
I'll,
you're the
I'm
guest.
just, yeah, just give me a second. I'm just trying to fix my Bluetooth so that my audio is better.
Your
Just
audio is
give me,
great, sir. Yeah, okay, sir.
okay,
Please take time.
fine. If that is okay, then it is fine. And yeah. Am I visible now?
Yes, sir.
All right, all right.
Okay,
Hello.
Dr. Archit, just one interruption. At the end of the presentation, we'll announce a online OPD with you. It's like a normal OPD where they have relevant cases, oncology. They share reports in advance with us, which we share with you. And then at a agreed upon time with you, they bring the patient to their clinic while the African doctor is there in the clinic and you join via Zoom. So post this event, we will that is another objective. So if you announce it yourself, that will be great, sir.
Sure. Will that be a regular affair or it is a one-time affair?
With some doctors, a regular affair. Like with Dr. Vikas Dua for sickle cell, it's a regular affair. There are multiple doctors from different hospitals. Uh,
No, are you talking about this OPD for today or
no, 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 no.
for when?
After this, because you will talk about this topic, they may have relevant patients. Now, to bring, okay, we'll discuss offline with you,
Yeah,
sir.
we discuss. I think, yeah, something that I was just taken out,
Okay.
suddenly taken. Yeah. Okay. So thank you, Mr. Varun. Thank you, Mr. Viniga, for helping me out. Next time I'll
welcome,
try
sir.
to learn something in French. Try my best.
Yeah,
Well.
yeah, that will be great.
It's a
Thank you.
Sunday evening here in India, and thank you very much, everyone, for taking out time on a Sunday. And I understand how tough that can be with family back home. And so I appreciate everyone coming here for the best interest of our patients, most importantly. So the topic that has been allotted to me is about gynae oncology, and I'll be discussing what are the gynae oncology advancements that have happened in India and what advancements how are we practicing in Fortis Healthcare. So I represent Fortis Escorts Okla and Fortis La Femme. Let me tell you that Fortis La Femme is one of its kind hospitals in India. It is dedicated to women health care, be it obstetrics, be it gynecology, or be it preventive medicine or gynae oncology in the sphere of oncology. So it's a completely dedicated gynae cancer hospital. And the other hospital that I come from is also from the Fortis group, that is the Fortis Escorts, where we practice all other oncology branches other than gynae oncology. Well,
Hmm.
this is the
Okay.
Fortis Healthcare Hospital, and I welcome you all from there. Uh, do you want me to stop here, Mr. Viniga?
Yes, maybe I can just translate as we go time to time. If you may stop slide wise so that I can, convey your message. Ok, donc le docteur, ici nous avons notre respecté docteur Archit Pandit. Donc il se présentait tantôt. Donc il appartient, c'est le directeur, donc comme je le disais, du service d'oncologie chirurgicale au niveau de l'hôpital de Fortis. Et donc Fortis, comme j'ai dit, c'est une branche indienne ou bien c'est une marque indienne d'hôpital. Et ils ont deux sections ou bien deux sous-branches. Donc, il y a Escort et Ocla. Donc, il expliquait que Ocla, c'est la branche qui se spécialise dans tout ce qui est gynécologie, cancer de la gynécologie, c'est-à-dire cancer au niveau de la gynécologie féminine. Et donc, la deuxième section, Escort, ça, c'est tout ce qui a trait au cancer ou à l'oncologie qui n'est pas relatif à l'appareil féminin ou à la gynécologie féminine. Donc, voilà à peu près sa présentation. Nous allons aller sans plus tarder. Yes, sir, you have the floor. Yes, doctor, you are muted. Please, you can carry on.
Yes. So our motto, to begin with, our motto is that we do not compromise on ethical care, which is the utmost importance for our patients. We try to give the most expertise care. And when I talk about expertise care, I'm talking about the human resource that I have in my team. All the cancer surgeons in my team are from All India Institute of Medical Sciences, which is the premier most institute in India. All are studied from there. Secondly, we do not compromise on expertise of instruments. So the instruments that we have in Fortis, be it robotics, be it high-tech, be it any standard of care, is one of the best in class all over India. The third point that I mean by expertise in care is that we follow ethical and most trusted guidelines, that is the guidelines of NCCN, that is National Comprehensive Cancer Network of US. So we follow these US guidelines for any kind of treatment that we have to provide to our patients. Most importantly, we understand that India and Africa both share common sentiments when it comes to cost. And I would like to tell everyone that we are one of the most cost-effective and one of the biggest brands of healthcare in India. Just to briefly introduce you to the whole, please.
Donc, il a commencé à parler de notre devise et leur devise à Fortis, c'est que ils font des soins éthiques sans compromis, c'est-à-dire qu'ils ne font pas de compromis sur tout ce qui est l'éthique parce que tous les spécialistes qui opèrent à ce niveau viennent de l'université All India, India Healthcare Institute. Donc ça, c'est la meilleure et la première des instituts, enfin des instituts qui forment les spécialistes dans ce domaine-là. Et donc, à cause de cela, ils ne font pas de compromis. Ensuite, nous avons les soins d'expertise, donc tout ce qui a trait au matériel utilisé, que ce soit robotique ou d'autres matériels ou instruments, dispositifs, et ils ne font pas de compromis dessus, donc ils utilisent le meilleur des meilleurs, donc la meilleure de la gamme, haut de gamme. Et ensuite, la rentabilité par rapport au coût à l'extérieur et dans d'autres infrastructures. Donc, Fortis est vraiment très, très, très efficient au niveau des coûts. Donc, le coût est très réduit et la qualité est meilleure. Yes, sir.
Just to briefly introduce what all we have done in last 2 months, we have done this surgery, one of its kind, in India. This was the first surgery which was done in India, in which we did a dual surgery in a Bangladeshi woman, and it was in all over the newspapers in India. And it was done for the first time, wherein we did a robotic breast cancer surgery along with a robotic heart surgery as well. Over to you.
OK. Donc, ici, il s'agit de ce qu'ils ont fait lors des 2 derniers mois. Ça, c'est une femme de Bangladesh sur laquelle ils ont fait une double opération lors des 2 derniers mois et l'information est passée au niveau des médias et dans la presse et toutes les chaînes nationales. En fait, ils ont fait une opération au niveau d'un cancer du sein et doublement un cancer du cœur. Donc, une double chirurgie qui a été effectuée sur cette dame avec succès et qui a résonné dans tout le pays. Yes, sir.
We have also removed the largest tumor from the body in India. Our team has removed the biggest tumor ever in India, and it was the fourth biggest tumor removed ever in the world. It was done in a Kenyan lady who was also HIV positive. The tumor was 10 kg in size, and it was 40 centimeter in size, and it was removed from the abdomen.
OK. Donc ici, nous avons donc un autre exploit de Fortis. Et c'était la plus grande tumeur donc qu'ils ont enlevée, qu'ils ont opérée d'une femme kenyane. Donc c'est la plus grande tumeur, quatrième mondialement, et en Inde la plus grande. Donc elle mesurait environ 40 cm et pesait plus de 10 kilos. Donc vraiment c'était un exploit. Yes, sir.
Our team has also done this first robotic surgery, which is a pancreatic cancer surgery, just done 2 weeks back. This was done around 2 weeks back in Fortis Healthcare. This was again one of its kind surgery, the first in India from Fortis. We have also treated another Tanzanian girl who was suffering with myasthenia gravis, and we did a robotic thymectomy for her.
Donc, nous avons ici donc la première chirurgie robotique donc, qui a été effectuée il y a de cela 2 semaines avec l'équipe de Fortis, et ça a donné vraiment un grand succès. Vous pouvez voir ça au niveau de cette plateforme-là, SS Innovation. Donc, c'est parti, la nouvelle s'est répandue là-bas. Et également, ils ont fait une opération sur donc, une dame tanzanienne, où ils ont donc effectué également cette robotique, donc ce qu'ils appellent la myasthenia gravis. Donc, c'est ce qu'ils ont effectué lors des les 2 derniers mois. Peut-être que la mise continue. Yes, sir.
This was a young boy from Kenya, which had a young girl from Kenya who had such a big tumor and this we had removed from her abdomen. This girl, suddenly her weight went down from 85 kgs to 78 kgs. It was around 7 or 8 kilogram tumor. And the life completely changed after doing this surgery because she was not able to breathe. It was an ovarian mass. It was a germ cell tumor, but not cancerous. So that's how her life was also saved. This is the tumor, if you can see it on the CT scan, occupying around 70% of the abdominal girth. So we do these. So I've specifically put African patients' surgical details over here, just to tell you that we treat a lot of variety of African patients. We take care of their cost. We do very complex tumors, gynecological as well as non-gynecological. Yeah.
Vinegar.
Oh, sorry.
Abdominal.
I was speaking, but I was muted. Yeah. Donc, je disais que ici nous avons une dame qui avait une très grosse tumeur abdominale qui a été enlevée. Donc, la tumeur était si grosse, elle avait environ 7 à 8 kg. Vous pouvez voir ça sur le scanner ici. Donc, ça occupait environ 70% de l'abdomen de la dame, et elle ne pouvait pas respirer. Elle ne pouvait pas respirer. Donc, maintenant, c'est que l'équipe de Fortis a fait du bon boulot et sa vie a été sauvée comme ça. Donc, le docteur expliquait qu'il traite vraiment sérieusement les patients africains, tout simplement parce qu'il y a des cas complexes vraiment qui viennent de là, et ils ont des résultats très positifs. Yes, sir.
This is a VATS lung surgery for a germ cell tumor of the ovary which had lung metastasis. So the tumor from the ovary in one of the females had gone to the lung. So we don't cut the whole chest. We do not cut the whole chest. We just remove it by a very small incision. We call it as VAT surgery, video thoracoscopic surgery, in which a small holes are made in the chest and we remove a part of the lung. So you don't need to remove the whole chest or open the chest. It can be just done robotically with small incisions and small cuts, and patient goes home within 4 to 5 days.
Donc ici, nous avons un autre résultat d'une opération qui a été avec succès. Ça, c'est une tumeur au niveau du poumon. Et ils ont fait une opération, donc ça s'appelle VAT surgery, c'est-à-dire que une chirurgie avec vidéo assistée. Et donc, ça permet d'avoir une opération mini-invasive, juste une petite incision, et on enlève la tumeur et le patient est prêt pour retourner chez lui au bout de 3 à 4 jours après l'opération. Donc, on n'a pas besoin d'enlever carrément le poumon ou bien d'ouvrir une large incision pour pouvoir opérer le patient. Yes, sir.
Okay. This is how this surgery was done. It was again done with small incisions, keyhole, and then a small cut to retrieve the mass. The thing was removed. Our team is also doing complex head and neck cancer procedures like these. We remove the whole mass again, African gentleman, and we reconstructed almost half of the face. This was after around 1 month of reconstruction. So these are the kinds of surgery that we do. And now then I will come to oncology updates.
Donc, vous pouvez voir sur l'image précédente, donc un jeune homme de l'Afrique également qui a eu sa reconstruction faciale faite donc, avec succès avec l'équipe de Fortis. Donc, il avait carrément toute la masse faciale qui était partie. Donc, ils ont fait du bon travail. Ils ont reconstitué une grande partie de la face et vous pouvez voir ça sur l'image précédente. Voilà, maintenant, il va toucher donc la chirurgie gynécologique du cancer dont on va parler aujourd'hui. Yes, sir.
So now we come to gynae cancers, our topic for today. When we talk about gynae cancers, we are basically talking about four basic tumors. One is cervical cancer, that is just below the uterus. We have the cervix. The ovarian cancers, which is usually late in diagnosis because ovary has such a huge area in the abdomen to grow. So usually they are detected when it is already very advanced. Endometrial cancer is something which is very, very interesting. Reason being, it affects both our societies, with nowadays kids not taking up physical activity. The problem with endometrial cancer is that obesity is growing in children, and that can lead to endometrial cancers. And the fourth and rare, but one of the most important ones, again, pertaining to both the communities, both the countries, is because these are the ones which are most related to sexually transmitted diseases leading to vulval and vaginal cancers.
Donc, quand on parle du cancer, donc, nous parlons principalement de 4 types de cancers. Donc, l'un, c'est le cancer du col de l'utérus, le plus fréquent dans les pays à revenus faibles ou intermédiaires. Et nous avons également le cancer de l'ovaire, donc, dont le diagnostic tardif est fréquent. Et nous avons le cancer de l'endomètre, ou bien le cancer de l'endomètre est généralement créé par le fait que dans nos sociétés actuelles, nous avons une très hausse de population qui connaît l'obésité. Donc, à cause de l'obésité croissante, nous avons donc le cancer de l'endomètre qui devient très récurrent. Et nous avons également le cancer de la vulve et du vagin très rare, mais très important. Pourquoi? Parce que c'est celui qui est vraiment très répandu dans les deux régions, aussi bien l'Inde que l'Afrique, à cause du fait que c'est lui qui est sexuellement, enfin, qui est créé par des activités sexuelles qui peuvent découler en ce type de cancer. Yes, sir.
In this presentation, we'll be only discussing about surgical advancements with respect to what all advancements we are going to see and we are already practicing in the sphere of surgery. What all treatments with respect to medical cancers we are taking up with respect to radiation oncology, as well as preventive oncology with respects to vaccines against cancers. So when we talk about surgical advancements, India has already started performing laparoscopic and robotic assisted cancer surgeries since last 2 decades. We are performing fertility sparing surgeries for early stage cancers, wherein we can spare the fertility by not removing the uterus or the ovaries. We use the technology of sentinel lymph node dissection by using ICG dyes. The benefit that we have achieved is that our morbidities have reduced and our hospital stays have become shorter with these surgical advancements.
OK. Donc, ici, dans cette présentation, nous allons principalement nous focaliser sur les progrès chirurgicaux ou bien les avancements technologiques dans le domaine de la chirurgie gynécologique. Donc, pour aller vite, donc, le docteur a listé donc, les 4 points principaux, les 4 axes sur lesquels il y a des progrès. Donc, en Inde, déjà, on utilise la chirurgie laparoscopique et assistée par robot. Donc, depuis un moment déjà, pas peut-être dans tous les pays du monde, mais en Inde, c'est déjà le cas. Ensuite, nous avons la chirurgie préservant la fertilité pour les cancers à un stade précoce. Donc, on essaie de préserver la fertilité de la maman ou bien de la dame en évitant d'enlever l'utérus afin qu'elle puisse concevoir plus tard. Donc, nous avons également la cartographie des ganglions sentinelles à l'aide d'un colorant qu'on appelle ICG, donc les colorants ou bien les marqueurs qu'on appelle ICG pour pouvoir détecter les cellules cancérigènes des cellules non cancérigènes. Et le résultat, c'est quoi? C'est que la morbidité a été considérablement réduite et les séjours hospitaliers ont été très, très raccourcis, donc sont devenus plus courts. Yes, sir.
Okay. So in this era of modern surgery, we started off with open surgery. We have gone to laparoscopic cancer surgery, and now we are performing robotic cancer surgery.
Donc, vous pouvez voir l'avancée technologique que nous avons eu. Au départ, nous étions dans donc, la chirurgie ouverte, donc, qui est l'initiale. Ensuite, nous sommes passés à la chirurgie laparoscopique et maintenant, nous sommes à la chirurgie robotique. Voilà.
The advantages of robotic is that the morbidity is less, the post-operative pain is less, both acute and chronic, shorter hospitalization, patients are less in the ICU, and they return back to their normal life faster, because nowadays everyone is working, be it the lady or the men. So they need to go back to their work faster. And apart from the robot, the thing that is again very much advanced in treatments is HIPEC surgery, which has come as a game changer in ovarian cancers.
Donc, may I get the previous slide and translate the advantages? OK, donc dans les avantages de la chirurgie robotique, nous avons donc, une diminution de la morbidité, une diminution de la douleur post-opératoire, que ce soit aiguë ou chronique. Nous avons l'hospitalisation qui est plus réduite ou plus courte, la durée d'hospitalisation. Donc, les retours rapides à la vie normale ou bien à leurs différentes tâches, puisque de nos jours, tout le monde est occupé à travailler. Donc, les hommes comme les femmes retournent dans leurs activités. Nous avons également eu particulièrement utile donc, pour les personnes présentant une comorbidité médicale important. Voilà à peu près les avantages de la robotique dans la médecine. Yes, sir.
HIPEC surgery has come as a game changer in ovarian cancers because ovarian cancers are generally diagnosed in stage 3rd or 4th. So HIPEC is one modality which I'll be talking in detail regarding how it has improved the lives of ovarian cancer patients.
Donc, ici, quand on parle de HIPEC ovarian cancer, donc en français, ça devrait être CHIP, ce que nous appelons. Une solution révolutionnaire pour le cancer donc, de l'ovaire. Donc, il a été utilisé pour l'ablation complète de la tumeur. Et donc, c'est très utilisé de nos jours pour une chimiothérapie chauffée, cible de la maladie microscopique. Donc, Fortis est également le centre leader de proposant cette solution-là. Elle améliore la survie et sans progression pour les cas avancés. Donc, généralement, les cancers sont détectés au stade 3 ou 4, c'est-à-dire un stade un peu avancé. C'est pour cela que cette méthode est très efficace. Yes, sir.
This HIPEC surgery is done after we completely remove the tumor from the body.
Yeah. Donc, yeah, you can go ahead, finish the slide.
We heat in HIPEC therapy, we heat the chemotherapy. It is called as hyperthermic, that is heated chemotherapy, intraperitoneal chemotherapy. So we heat the chemotherapy and put it inside the peritoneum. This heated chemotherapy targets the microscopic disease. Fortis Hospital, where we are, is one of the leading centers which offers CRS and HIPEC surgery. And it doesn't only improve the progression-free survival, but has also shown to improve the overall survival of patients who undergo HIPEC surgery, especially for ovarian cancers.
Donc, comme je l'expliquais tantôt, donc cette chirurgie, HIPEC surgery, donc en français c'est CHIP, S-C-H-I-P. Et donc, cette opération, bien cette méthode d'opérer, elle est utilisée généralement après l'ablation complète de la tumeur. Et ensuite, la chimiothérapie chauffée cible les maladies donc microscopiques. Et au niveau de Fortis, c'est Fortis qui est un centre leader ou bien un centre, le premier centre, je peux dire, qui a commencé par offrir ce genre de traitement ou de prise en charge aux patients, donc CRS, HIPEC. Et également, nous avons le résultat, c'est que ça améliore considérablement la survie sans progression dans les cas avancés. Yes, sir.
Okay. So what does HIPEC mean? HIPEC means heated chemotherapy put inside the in the abdomen of the patient. We heat the chemotherapy to the tune of 41 to 43 degrees centigrade, and we circulate it inside the abdomen while the surgery is performed for 60 to 90 minutes.
OK, donc qu'est-ce que nous entendons par HIPEC? C'est en fait la chimiothérapie chauffée ciblée. Donc la chimiothérapie chauffée ciblée, ça cible les cellules microscopiques. Donc ce que ça fait, c'est qu'on fait chauffer donc la chimiothérapie à 41 à 43 degrés Celsius pendant que l'opération est conduite ou bien est effectuée entre 60 et 90 minutes. Donc, ça désigne l'installation de médicaments de chimiothérapie chauffée dans la cavité abdominale, en fait.
So when we go inside the abdomen, wherever we see the gross disease, for example, we can see the gross disease over here, we can see the gross disease here, all these are the gross disease. So we remove all this gross disease and we put in the macroscopic disease. What we can see from the eye is removed, and what we cannot see from the naked eye, that is the microscopic disease. For that, we perform the HIPEC surgery.
OK. Donc, lorsque nous allons dans l'abdomen, sur cette photo, vous pouvez voir partout là où nous avons cette tache blanchâtre sur cette masse jaunâtre qui est donc la graisse. Donc, vous voyez que ça, ce sont des trucs que nous pouvons voir. Donc, on enlève ces parties-là et maintenant pour les parties microscopiques, donc les parties maladies et les cellules microscopiques qu'on ne peut pas voir, donc on fait le HIPEC surgery. Donc, le HIPEC surgery, c'est ce que nous venons d'expliquer, qui est donc l'installation des médicaments de chimiothérapie chauffée dans la qualité de la cavité abdominale. Yes, sir.
This is the machine of the HIPEC, wherein the whole chemotherapy agent circulates from the human body to the machine and then back into the human body and then back to the machine. This is how it circulates and the temperature is maintained over here. This is the body, and we'll just, in the next slide, we'll see the video, a small video wherein I'll be explaining in the surgery how the HIPEC is performed. So
I'm Dr. Archit. I'm head of Department of Surgical Oncology at Cervical International Hospital, Delhi. Today we'll be telling you about HIPEC, how HIPEC is done. HIPEC is basically done for peritoneal cancers like appendix.
So the HIPEC is done for peritoneal malignancies like appendicular cancers or the ovarian cancer. This is the whole machine that I was showing you in the previous photograph, and the whole chemotherapy agent gets circulated from the human body inside the body and then go back to this machine and then comes here and then keep circulating for 60 to 90 minutes.
Donc ici, vous voyez, donc, par exemple, dans la diapo précédente, il a montré le schéma de comment est-ce que ce dispositif fonctionne, ce HIPEC. Donc, cette méthode consiste donc à faire circuler donc la chaleur de façon continue pendant 90 minutes, 60 à 90 minutes sur une température de 41 à 43 degrés Celsius pendant que l'opération est en train d'être faite. Donc, on conserve la température du patient à côté et on fait suivre ça par des moniteurs. Et ensuite, donc, on fait l'opération, comme je le disais, en injectant donc en faisant la chimiothérapie chauffée. Yes, sir.
So this surgery is not something that we have just started to perform. We are doing this since past around 15 to 20 years now.
Wow. Donc, cette chirurgie, on n'a pas commencé très récemment. Ça fait déjà 15 à 20 ans que cette technique a déjà a été utilisée ou est en utilisation au niveau de leur hôpital.
The next advancement is in the field of robotic and laparoscopic gynecological cancer surgeries. Laparoscopic cancer surgeries we have been doing since past 20 years now. We have the largest series of gynecological endometrial cancer tumors in India in the private sector. The robotic surgery we have been doing since past 2021, so around 4 years. And we have done quite 200 cases of gynae cancers with robotics. The benefit is smaller incisions, better outcomes, equally good oncological clearance as compared to open surgery, less morbidity and lesser mortality.
Voilà. Bon, donc, ici, autre avancement technologique ou bien autre progrès technologique au niveau de la médecine, nous avons la chirurgie gynécologique oncologique robotisée et laparoscopique. Donc, les résultats et les avantages. Mais avant ça, le docteur expliquait qu'au niveau de Fortis, ils ont fait donc la laparoscopie depuis déjà plus de 20 ans. Et à plus de 20 ans, et avec cette laparoscopie, ils ont déjà eu beaucoup de résultats et ils ont le plus grand dossier ou bien le plus grand record de tous ceux qui ont fait ce type d'opération dans le domaine privé. Ensuite, nous avons 200 la robotique. Donc, pour la robotique, ça fait déjà 4 ans qu'ils font la robotique dans leurs hôpitaux.
So, apart from HIPEC robotic, this laparoscopic surgery is what we have been performing since many years, and we have a lot of subscribers, especially doctors who follow our YouTube channel. This is my YouTube channel, if you can see, and this particular video has been seen probably more than 100,000 times. it has been viewed, it has been taught in a lot of medical colleges of how to perform a safe dissection of radical hysterectomy for endometrial cancers, sometimes for early cervical cancers, as well as for early ovarian cancers. We conduct a lot of fellowship programs for doctors who are interested in performing, especially gynecologists who would like to perform or learn laparoscopic radical hysterectomies and laparoscopic hysterectomies.
Donc, ici, vous pouvez voir sur sa chaîne YouTube. Si vous voulez, on va partager le lien de la chaîne YouTube. Donc, ça, c'est une vidéo de comment faire la laparoscopie. Et ça, cette vidéo a été déjà vue plus de 100 000 fois. Donc, plus de 100 000 vues. Et on utilise ça également dans les institutions de formation ou bien dans les universités pour enseigner comment faire effectivement cette procédure-là sans endommager les cellules saine du patient. Donc, le docteur dit qu'ils conduisent également, donc ils effectuent également des réunions ou bien des petites formations, je peux dire, pour ceux qui sont intéressés, les docteurs qui seraient intéressés pour pouvoir participer à comment faire ces opérations-là de la laparoscopie. Donc, voilà. Yes, sir.
I hope you can see the PowerPoint presentation. I just had to change it. So now coming to cervical cancer. Okay. Now coming to cervical cancers, the best part about cervical cancers is that it is preventable by vaccination. So we'll be discussing about vaccination in short. We encourage a lot of patients to undergo regular checkups with pap smear examinations, HPV testing, and also we try to encourage them for vaccinations, especially in the age group of 9 to 26 years of age for both boys and girls.
OK. Donc ici, nous avons donc le cancer du col de l'utérus. Il est évitable et guérissable s'il est détecté tôt. Mais il y a également les symptômes qui ressemblent souvent à ceux d'une infection. Donc, quelquefois, il peut passer inaperçu. Donc, il recommande pour les patients, il les encourage donc, de faire les frottis vaginaux réguliers, les tests HPV et les IVA, IVL. Et également, ça peut être prévenu avec les vaccins. Donc, si on recommande que les patients ou bien les potentiels patients de 6 à 26 ans, de 9 à 26 ans, puissent faire donc régulièrement des visites médicales pour pouvoir voir si on peut détecter ces gens-là, le truc de pathologie assez tôt. Yes, sir.
So once we are done with the surgical advancements in Fortis and India, coming to diagnostic tools, I'm just talking about the advanced procedures that we are doing now, not touching the routine that you already know. Apart from the transvaginal sonography and PET MRI, we have now moved on to PET CT, which is something that scans the whole body and looks whether the cancer is spread to any other part of the body or not. There are certain genetic tests that detect and tell us which person can be at risk of developing cancer in future by the name of BRCA. Just to mention that Angelina Jolie also underwent a BRCA test, HRD test, MSI testing, and next generation sequencing, which is now being rampantly performed in India in 5 to 7 centers. We are also integrated artificial intelligence in our pap smear technology, in our radiology department, in our CT scan centers, which help in early diagnosis, reduces the human error, and help us in decision making.
Donc, le docteur dit qu'à part les procédures de routine que nous connaissons généralement pour les traitements en oncologie, donc l'échographie transvaginale et donc l'IRM pelvienne, donc on passe maintenant à l'imagerie PET-CT avancée, donc PET-CT. Donc, Le PET, CT avancé, c'est une nouvelle technologie qui permet de pouvoir avoir une imagerie ou bien un scanner complet du corps humain pour savoir si il y a la maladie s'est répandue dans certains organes ou bien dans certaines parties de l'organisme. Et donc, ça permet de le détecter. Et il y a également le test BRCA. Donc, le test BRCA, c'est des tests génétiques de mutation pour pouvoir détecter. Il y a également le HDR et le MSI et le Next Generation Surgery. Donc, c'est en fait le NGS. Ça, c'est-à-dire que des trucs de nouvelle génération pour pouvoir identifier les cellules cancérigènes. Donc, le test BRCA, là, il y a même cette actrice, donc Angelina Jolie, je pense que vous la connaissez, elle est de Hollywood, qui est passée par ce test-là. Et donc, il y a également l'utilisation de l'intelligence artificielle dans le diagnostic précoce et la prise en charge qui permet donc de prévenir et aussi de pouvoir traiter efficacement les maladies de cancer. Yes, sir.
Apart from the tests, coming to chemotherapy or medical oncology, apart from the routine medical oncology, the chemotherapy drugs, I will not be mentioning about that. But what I'll be mentioning very importantly is certain tests, certain immunotherapies or target therapies which target only the tumor and not the normal cells of the body are the PARP inhibitors for BRCA positive ovarian cancers. There are certain other immunotherapy and target therapy drugs that help us in ovarian cancer and cervical cancers. A lot of immunotherapies for high MSI and for cervical cancer. So basically, this slide just tells us that there are a lot of advancements happening for targeted therapy and immunotherapy, which is frequently available in India.
Donc, ça, ce diapo nous montre juste on ne va pas passer avec les procédures de prise en charge normales, comme il le disait. Nous avons donc la thérapie ciblée et l'immunothérapie ici. Donc, nous avons les inhibiteurs PARP. Et pour le cancer de l'ovaire, donc ça permet de pouvoir traiter le cancer ou gérer pour convenablement le cancer de l'ovaire, donc le BRCA positif. Et nous avons le bevacizumab. Ah, ça c'est un nom, ça. Dans le cancer récurrent de l'ovaire et du col de l'utérus. Donc, il y a les inhibiteurs de points de contrôle pour donc, les cancers de MSI élevé. Et donc, nous avons également l'autre tisotumab donc, dans le cancer du col de l'utérus récurrent. Donc, en fait, ce que nous comprenons sur cette diapo, c'est qu'il y a des avancées et des prises en charge qui sont très utilisées ici en Inde depuis un moment donné pour pouvoir améliorer les conditions du patient. Yes, sir.
So coming to a very interesting topic, which I feel that many in Africa can also relate to. See, because India and Africa have very high cervical cancer incidence. That is because of our socioeconomic strata is the same. There are a lot of sexually transmitted diseases, lack of sexual education among the young, and which has led to a high chance of cervical cancers in India. There are two cervical cancer vaccines against human papilloma virus. That is the Cervarix and the Gardasil. These are the two vaccines very prominent in the world. But India has come up with their own cervical cancer vaccine called as Cervavac. This is an Indian-made vaccine, very, very cost-effective, very cheap, and which is now being routinely administered to girls and boys from the age of 9 to 26. The most effective time is 9 to 14, but usually are given from 9 to 26. Here, I would say that it is very important for general practitioners to understand the efficacy of human papilloma virus vaccine so that they can be huge advocate for these vaccines as well as create awareness in their community. It has a huge potential of replication in African countries as well, as I said. However, I see that not many, whenever I visit to Kenya and Uganda, I see that these vaccines are not very, very frequently available. So I would strongly advise that girls and boys in the age of 9 to 26 should undergo these vaccinations.
OK, donc ici, c'est un aspect très important et très intéressant pour le docteur. Il s'agit de la vaccination contre le VPH en Inde. Donc, c'est-à-dire que ce sont les cancers principalement qui sont liés donc aux activités sexuelles, comme on le disait. Et il y a des vaccins qui sont disponibles au monde. Il y a 2 vaccins qu'il a mentionnés qui sont utilisés, mais il y a l'Inde qui a fabriqué son propre vaccin. Donc, le vaccin indien contre le VPH à faible coût et qui est très, très efficace, c'est le Cervavac. Donc, le Cervavac, on l'administre de façon générale et de façon automatique, routinière aux filles âgées de 9 à 14 ans. Généralement, ça, c'est le moment idéal, mais on peut les administrer de 9 à 26 ans pour ceux qui sont donc toujours dans la tranche d'âge. Ça permet de prévenir donc ce type de choses. Donc, comme le docteur dit, il voyage en Afrique et il voit que nous n'avons pas ce type de vaccin compte tenu du fait que ce n'est pas disponible. Et aussi, il y a un faible taux de sensibilisation au niveau des activités sexuelles et de comment il faut s'y prendre. Donc ici, nous avons le rôle des médecins généralistes dans la défense des droits et de la sensibilisation qui est très importante. Et donc, le potentiel de réplication dans les pays africains. Donc, il recommanderait vraiment que les docteurs généralistes et les docteurs oncologistes puissent recommander ces vaccins-là donc de façon systématique dans leur procédure. Yes, sir.
Coming to, there are hundreds of red flags that I can just keep talking, but unfortunately not everyone would be able to remember. But I just want to tell you there are just 4 major red flags in gynae cancers that we as general practitioners need to identify and point them out at a very, very early stage. First and foremost, any woman who has achieved menopause, and if she has bleeding after attaining menopause, should undergo a testing because she can be harboring endometrial cancer, that is the uterine cancer. That is number 1. Number 2, if there is any pelvic mass that you can feel on an examination or an ultrasound, one should not ignore. Number 2. Number 3, any abnormal pap scan should not just be left like that. Any abnormal pap scan or human papilloma virus positivity should be followed up with another pap or HPV test just to ensure that the cervical conditions are favoring and regressing rather than elevating. And 4th, if there is any woman or male who has a family history of ovarian or breast cancer or endometrial cancer, please consult your oncologist nearby. These are the 4 facts that I would just like to stress on, rather than listing numerous 30 or 40 signs or symptoms, early signs or symptoms.
OK, donc nous avons généralement une centaine de signes ou bien de symptômes qui peuvent indiquer donc un cancer gynécologique, mais le docteur a voulu se focaliser ou s'accentuer juste sur ces 4 points-là. Donc ces 4 points, c'est ça sur la diapo. Et donc les drapeaux rouges que nous pouvons avoir, c'est que tout saignement post-ménopause, monopausique ou irrégulier. Donc, tout saignement post-ménopausique ou irrégulier donc, doit déjà attirer l'attention du docteur pour un test approfondi pour identifier s'il y a un cancer. Donc, une femme qui a dépassé la ménopause et qui saigne de façon irrégulière donc, doit pouvoir passer ce test pour étude. Ensuite, la masse pelvienne, c'est-à-dire toute masse pelvienne que vous détectez lors d'un examen ou bien lors d'un scanner ou d'une échographie à l'intérieur de l'utérus d'une femme ou bien de la région pelvienne d'une femme, donc vous devez automatiquement penser à approfondir vos recherches pour détecter un cancer. Donc également, on peut faire un test PAP pour donc le vaccin contre le papillome humain. Donc si vous faites n'importe quel test et il s'avère anormal ou donne un résultat anormal, donc vous devez déjà commencer par suspecter un cancer et approfondir vos résultats. Également, nous avons les antécédents familiaux de cancer. Donc, si dans la famille, il y a eu des gens qui ont eu des cancers de l'ovaire ou du sein ou de l'utérus, donc vous pouvez déjà commencer par faire des études approfondies sur votre patient en question pour voir s'il n'y a pas de risque qu'elle développe également cette même pathologie. Yes, sir.
Now, there are ways of collaborating with Fortis India, that is at different levels. We can help each other out in various ways. First and foremost, the most important thing is that we can do virtual consults and take second opinions, for which we can always be available online on a particular day and time, and we can come and try to discuss patients and clinical evidences and how to go forward. Irrespective of whether the patient is traveling to India or not, our main goal and aim here would be to help in whichever way we can. Apart from, of course, cross-border patient referrals, we are actively performing training and observership programs for doctors, especially gynecologists, surgeons, as well as general physicians who can be part of the tumor program, the tumor boards, and other programs that we run across Fortis. We also,
Dr. Archit, sorry to step in here. So we at Jivo have organized a very organized, and the purpose is so that they collaborate with the top brands of hospitals in India and with you. And it's not like a program run in silo. It's a very well designed program for the audience, and
great.
we will communicate that to them and we regularly do it. So we can, I mean, we can move further. Sir.
So coming to my last slide, just summarizing the whole thing, that general practitioners are very crucial for early detection of these patients and referring them to an oncology center or oncology care. India definitely offers a very affordable, however, advanced cancer care, which provide ethical as well as care as per the international standards, international guidelines. At Fortis, we lead in high-tech surgery, molecular oncology, targeted oncology, immunotherapies, as well as next-generation sequencing tests, which are being performed. And I believe that together, we can definitely help each other and improve cancer outcomes and do good for our general public. Thank you so much.
Yes.
Translate.
Yes. Ok, donc ça c'est la dernière diapo du docteur. Donc le docteur fait un résumé. Il dit, les médecins généralistes jouent un rôle crucial dans la détection précoce et l'orientation des patients par rapport à ces types de pathologies. L'Inde offre donc des moyens, des soins avancés et adorables contre le cancer. Et Fortis est un leader dans la robotique, dans la méthode high-tech, l'oncologie moléculaire et bien d'autres pour pouvoir assister ou collaborer avec d'autres de vos spécialistes à travers le monde. Ensemble, donc, le docteur pense que nous pouvons donc améliorer les résultats de la lutte contre le cancer à l'échelle mondiale. Et donc, il vous remercie pour votre aimable attention. Si vous avez des questions, n'hésitez pas à les poser ou à les mettre dans la boîte de dialogue. Yes, sir.
No, we want
Varun,
to.
what we don't know.
No, it's a question and answer, sir. Okay. We want to take it at the end, sir?
No, we can take it at this is the end of my presentation.
Okay. First, a very heartfelt thanks. You know, the way you structured this talk. First, you demonstrated capability of India. I mean, makes me very proud. And you also touched upon AIMS. And I want to tell the audience how difficult it is to get inside AIMS. Dr. Archit said this entire team. We are a country of 1.4 billion people and only 30 odd students every year. Maybe, sir, it might have increased to 50 now, but 30 odd students get highly competitive. I myself graduated from IIT Delhi, IITs of prestige, but we have a lot of ego. But AIMS, I mean, if somebody is studying from AIMS, it's better than Harvard Business School. I mean, the competitiveness is so there. I mean, I just wanted to highlight your credentials there. And I mean, it is like field medal in mathematics. I mean, that's how that Dr. Brain is. But what we want to highlight, sir, thank you for the way you structured this talk. You demonstrated the capabilities India have, and it makes us very proud that in one field, which is healthcare, thanks to the excellence of doctors and these great hospitals and infra, I mean, our medical outcomes are one of the best in the world. This is one field where, you know, we are punching right above right along with the big boys. And the capabilities of Fortis Hospital in particular, like Pan India and the excellence it brings, and the way you laid out, oncology, surgical oncology, and gynecology, it was very beautiful, sir. And I hope the audience benefited. And sorry for interrupting you there, because what you were saying about collaborating and educating, we are also doing it in a very structured format. And we are very fortunate that we are being supported by Fortis as a group, also like Max and Artemis to join in this, that we have to empower the GPs who are practicing in Africa for early detection, for not only for medical referrals, but with the learnings that they gain from you, how they can support the patients better. And our dream is, like, as Bill and Gates Foundation say, that there are 15 million avoidable deaths every year. And we're not talking about avoidable deaths, that if there was a right doctor consultation, a right medication change, that could be avoided. And the majority of those deaths occur in Africa. So medical tourism is just a byproduct. This whole initiative is to bring this excellence that is practiced by doctors like Dr. Archit, and bring a framework so that there is a more doctor to doctor collaboration between in the Africa and India corridor. Because I believe the only bridge that exists today between doctors like Dr. Archit and the African audience is agents. And the whole Jivo vision is that healthcare should be handled by doctors and doctor collaboration. And that's the vision. And thank you, sir. And right now, Vinegar, you will translate this to French, whatever I spoke. And right now, please put your questions to Dr. Archit. He talked about
No.
diseases, symptoms, which are very widespread, and many people suffer from that. Please.
Yeah. OK, donc, si vous avez des questions, n'hésitez pas à les marquer dans la boîte de dialogue, comme je disais, ou bien noter vos questions là. Le docteur est disponible pour recevoir vos questions. Mais avant ça, je vais donc traduire ce que le fondateur disait tantôt. Donc, en réalité, il a remercié notre présentateur, le docteur Archit, pour sa brillante présentation et très enrichissante. Donc, la façon dont il a structuré ça montre combien de fois, c'est l'excellence de l'excellence, en fait. Parce que nous sommes une population de 1,4 milliard de personnes, je veux dire, en Inde. Et au sorti de cette population, donc, pour voir la crème de la crème, on a environ 30 à 50 personnes max. Donc, qui sortent chaque année comme experts dans des domaines tels que l'oncologie gynécologique à la pointe de la technologie. Donc, il disait que la façon dont cela a été structuré et expliqué, donc ça le rend assez fier. Et la plateforme que Jivo offre, donc Jivo, c'est la plateforme qui vous est offerte pour pouvoir permettre ce genre de collaboration, donc un cadre assez structuré, systématique pour amener les docteurs, une collaboration docteur-docteur ou bien consultant-consultant ou spécialiste-spécialiste, afin que donc vous puissiez faire une sorte de brassage donc, où les informations ou bien les compétences, les expériences sont partagées et aussi où on peut donc organiser des façons de pouvoir amener des patients ou bien vos patients à avoir donc des prises en charge plus effectives ou plus recommandées donc dans le domaine de la technologie et dans le domaine de prise en charge de ces pathologies en Inde. Donc, les spécialistes indiens tels que donc les institutions Fortis, Max, et il y a Artemis et d'autres grandes institutions travaillent en collaboration avec Jivo pour vous offrir ce cadre-là. Yes. Donc, si vous avez des questions, n'hésitez pas. Yes.
No, I just want the participants, they must have questions. If you are shy to ask, you can type. Doctor is here with us.
Yeah. Donc, si vous avez des questions, le docteur est avec nous. Je ne sais pas si vous avez suivi la présentation, il a mentionné beaucoup de points et donc il est rentré dans beaucoup de détails. Et donc, si vous avez des questions, ne soyez pas timide. Et si vous êtes timide à parler, vous pouvez mettre ça par écrit dans la boîte de dialogue. Donc, vous devriez certainement avoir quelques questions.
Okay. Okay, Dr. Sunday has asked a broad question about better healthcare delivery to Africa. Not specifically the question, but Dr. Sunday, this is what we are bringing. A lot of knowledge sharing is with interacting with the Indian specialists who are using cutting edge technology and process in every day and achieving successful medical outcomes. And I'll speak to you, sir. This was a private message to me. I'll speak to you, sir, regarding this. Now, what is there is a question from Dr. Mizi Kashweka. She is from Zambia, Lusaka. What is the range of cost for the laparoscopic surgeries for gynec onc cases? And she understands that it depends on the complexity of the surgery. She just wants to know the range. And does the hospital offer chemoradiotherapy, IMRT, VMAT? So the question is for you, Dr. Archit.
So that's a very valid question. So when it comes to laparoscopic cancer surgery, usually the cost ranges from around 5,500, 5,000 US dollars to 5,500 US dollars. It could be a laparoscopic radical hysterectomy. It could be a laparoscopic hysterectomy, even sometimes myomectomies. For endometriotic surgeries, we very frequently perform surgeries for endometriosis because these are the surgeries which are very difficult and generally the gynecologists don't want to venture into it. So we get a lot of references for endometriosis. The cost can range from around $5,000 to $6,500. Yes, Fortis Healthcare definitely has radiation oncology. We have all the 3D CRT, IMRT, IGRT, as well as 3D ARC, as well as CyberKnife, tomotherapy, brachytherapy, that is with regards to the radiation therapy. Amongst medical oncology, we are already practicing the medical oncology part, but other than that, we have access to target therapy, we have access to immunotherapy, and now we also have in India at one center CAR T cell therapy, which is again one of the most advanced treatment mechanisms in the world right now.
Yes, donc ici, il y a une question qui a été posée de savoir quelle est la fourchette donc, des coûts pour les chirurgies laparoscopiques dans le cas de la gynécologie. Et donc l'intéressée disait que bon, elle sait que ça dépend de la complexité de l'opération, mais elle voulait une fourchette. Donc, et est-ce que l'hôpital propose donc des chimiothérapies, chimio-radiothérapie en fait? Et oui, le docteur a répondu en disant que c'est affirmatif à Fortis. Donc, Fortis possède toute l'équipe complète de tout ce qu'on peut imaginer sur donc la chimiothérapie, la prise en charge donc oncologique et la prise en charge de l'oncologie gynécologique. Et donc, il a expliqué que la fourchette se situe entre 5 000 et 6 500 $. 5 000 et 6 500 $ en fonction de, donc, des variations et des complexités de l'opération. Mais généralement, c'est ça la fourchette. Et donc, ils ont également accès à beaucoup d'autres technologies ou bien méthodes de pointe telles que l'immunothérapie, donc la thérapie ciblée. Et même, ils ont une nouvelle, dans l'un de leurs centres, une nouvelle approche qui est la thérapie basée sur la particule ou la partition. Donc, voilà à peu près, ça c'est encore une technologie plus poussée pour pouvoir travailler cellule par cellule. Bon, donc c'est à peu près ce que le docteur venait d'expliquer. Yes.
Dr. Archit, there is a question from Dr. William Gadaga. He is from Zimbabwe. The question is, what is the utility of high intensity focused ultrasound therapy for gynae malignancies? Is it available at your institution and what are the costs? Sir, you are on mute. Dr. Archit, you are on mute. You have to unmute yourself. Yeah.
Okay. So focused high frequency ultrasound therapy is generally used for certain small size fibroids. It is being performed. My area of interest is malignancy, that is cancer surgery. But yes, focused high frequency therapies are being performed in Fortis, and the cost ranges from somewhere around 4,500 to 6,500 US dollars.
Now, there is a question from Dr. Zamenu from Ethiopia. It's slightly broad-based. He has two questions. So, Dr. Zamenu, I think Dr. Archit has already covered it, but I'm repeating. What are the advancements Fortis has made for African patients with gynecologic malignancies? What are the most recent and frequent surgical treatments you gave? Estimated cost for each surgical treatment options for gynecological malignancies. Before answering, sir, I want to clarify that this is a recorded session and we will provide those participants who attended, we'll provide them access to this so they can go through your talk later. But if you want to address this question, sir, to you, I can repeat. What are the advancements Fortis has made for African patients with gynecologic malignancies? What are the most recent and frequent surgical treatments you gave and estimated cost for each surgical treatment options for gynecologic malignancies?
So, can you just repeat the question to be precise?
Can you access? Is the chat visible to you, sir? It's on the public chat. The question is, what are the advancements Fortis has made for African patients with gynecologic malignancies? I think you already
Okay, so
covered
there is nothing advancement which is particular for African patients, but yes, what I can suggest is that there is definitely a sphere of utilizing cancer vaccines with regards to oral cancers, cervical cancers, genital cancers, vaginal and vulval cancers that can very, very much be spread across forums with regards to African patients as well as African general practitioners. This could be a very, very important and very, very useful topic of discussion as well as practice when it comes to vaccines for cervical and other cancers. Secondly, with regards to advancements in gynae cancer surgeries, the most important, as I mentioned in my slides, was HIPEC surgery. HIPEC is hypothermic intraperitoneal chemotherapy, which is done for certain cancers like colon, ovarian cancers most frequently, peritoneal cancers, appendiceal cancers, rectum, as well as for stomach cancers. Now, HIPEC therapy, how it has revolutionized treatment is by uh, because ovarian cancers are generally diagnosed in the stage 3C or stage 4. That is the time when already the cancer has already advanced to a very, very higher stage. What happens is that these patients were frequently being neglected, as well as no treatment were available for them. Of late 10 to 15 years, HIPEC therapy has really come as in the forefront. With this, we are treating stage 3C as well as some stage 4 cancers, and which has shown tremendous improvement in certain cancers of ovarian cancers with regards to gynecology. Second most important advancements that has happened is robotic surgery and laparoscopic cancer surgery with respect to retroperitoneal lymph node dissection, endometriosis surgery, or radical hysterectomies and pelvic node dissections. And the fourth advancement that has happened in the sphere of cancer surgery is sentinel lymph node dissection. Now, sentinel lymph node dissection is nowadays we don't need to perform the pelvic lymph node excisions that we usually perform with a lot of endometrial and cervical cancers. Now we are identifying that one lymph node where the tumor spreads, and we pick it up and we remove that instead of removing all the other lymph nodes and causing a lot of side effects.
Okay.
And
So
the cost of this usually varies from 5,000 to 6,500 to $7,000. HIPEC surgery cost is around 11,000 to 12,000 US dollars.
Okay. So there's another follow-up question from Dr. Gadaga, because you said that stage 3 onwards that surgery option comes in, but he wants to know that is HIPEC, is it possible, that stage that to operate on a patient of stage 2 cervical cancer with HIPEC or any other technologies?
No, HIPEC is not for cervical cancers. I mentioned it very clearly that HIPEC is used only for peritoneal cancers, for appendiceal cancers, ovarian cancers, colon and rectum cancers, and some stomach cancers. These are the only 6 cancers where HIPEC is beneficial. So with regards to gynecological cancers, ovarian cancer and endometrial cancer are the only 2 cancers where HIPEC can be used. For cervical cancers, we can either go for surgery, and if it is stage 2B onwards, then we go for chemo and radiation therapy, and then some kind of an immunotherapy.
So another question, sir, like about foreign GPs. I mean, if they want to do surgical courses at Fortis, although Shagufta will share the details with us, but if you tell them how can they access, like GPs from Africa, if they want to do specific surgical module courses at Fortis, how can they access it? One way
So
to
if
Jivo, but it
if
might be the right?
so, Varun, with general practitioners, do we mean surgeons, general surgeons,
So
gynecological
he
surgeons?
just meant GP, sir, and GP general practitioners. Sir, I mean, Dr. Gadaga, can you specify? I mean, do you by GPs, do you mean surgeons or just general medicinal doctors? So mostly, sir, uh, I mean, medicinal side, not surgical side. That's what.
Okay. So for medicine side, yes, you can come for an observership. We cannot give you hands-on because in India, hands-on is generally given to foreign doctors who are surgeons or gynecologists. But we can definitely give you an overview of cancer with regards to our preventive health checkups, with regards to our medical oncology side, and as well as surgical oncology side. Be a part of our tumor board. That is the best part to be, because that is where we all take decisions. We bring all the world literature on the table. It's a it's a round table meeting called as the tumor board, where the whole board sits and discusses about each and every case.
Hmm. Uh, I mean, I think we
Anything?
have, I think we have exceeded the time also, sir. So if there are any further question, the Jivo team will share with you. All of these GP doctors, they have a work group specific to them with Jivo team member, and whichever questions we have, we'll direct them to you. But one more part of initiative is, many times knowledge sharing is one thing, and real help is another thing. So what we have organized this initiative and with multiple of your colleagues from different hospitals. So what happens is, if they have, by the way, Dr. Archit is not limited to gynae oncosurgery. He does, this topic was only with that. He's an oncosurgeon for other body parts also. So what we do is, like, if they have patients, complex conditions, something that they, as a doctor, they have indication that very difficult to handle here, maybe a foreign expertise or opinion helps. So to a fast track and to give a very trusted channel, not that of an agent. So the doctor, our African doctor partner, they collect the reports, share with us. We created a dossier, share with surgeons like you who can look at it and then the relevance, and they can choose, and then they invite the patients to their clinic, and via Zoom you join while they are present with the patient. We call it, sir, online OPD. Like when we were at IIT, sir, we had our own clinic, but there would come a doctor on, let's say, Monday. It would call OPD. So it's that version, but online through technology. We are taking your expertise to a clinic of a doctor in Zambia, in Lusaka, or let's say in Kinshasa, DRC. Our team will follow up with you, sir, if that is the kind of thing you want to help our African colleagues. It gives patient a digital clinical pathway, like how it should happen, and we will
Yes.
announce it and circulate it. And we'll do that. That's what I was talking about on NOPD, sir. So that's that version that we do here. Same there, sir.
Yes, Varun, I think it's a beautiful initiative because ultimately we are, as our Prime Minister also says, Vasudev Kutumbakam. That is, we are just one world. So whatever best we can do to help our patients, I'll be more than happy. I've just shared with you my number. Please do get in touch. I'm usually our tag time to respond is within 1 hour. If there's anything, any query regarding any patient, we respond within our 1 hour. I have a team of 4 to 5 surgeons. Everyone specializes in their field, and I'm the director at Fortis. And I personally look into GI and gynae, and so there is a doctor under me who looks after head, neck, breast, and so on and so forth. So we'll be very happy to partnership and will be obliged if there's anything that you can we can be of help in.
Sir, our objective is simple. As a doctor, I'm a techie, sir. As a doctor, you know more about healthcare, and our African counterparts, when they emigrate to US, they are also excellent doctors. So the challenges are in the ecosystem. Challenges are in the entire
Connection.
infrastructure connection. So what we want to build, sir, like in India, if there is a patient in Meerut, it's very easy for them to connect to you, and normally
Yes.
their doctor refers them to you. So we are building this referral structure from doctor to doctor. The only thing in India side is we work with only tier one hospitals or those brands like Fortis that stand for excellence, so that the African doctor counterparts are comfortable that they are referring their patient to the right hospital. So that's what we are building.
Pleasure.
Doctor to doctor collaboration is the future, and hopefully,
Yes.
like when companies scale, like Zomato, Zepto scale, they change the industry. That's what I intend to do. This
I'm
collaboration,
sure. I'm sure.
middlemen and
Your
agents are
approach is
eliminated.
great. Your intent is pure. Your approach is great, and I think it'll be. We are very happy to collaborate with such partners. And
So
we'll be very happy.
there's a Dr. Michelle here from DRC Kinshasa. Dr. Vikas Dua from FMRI, sickle cell disease. His team, they have made a regular feature. So sickle cell disease very prevalent, and this is how we are doing, sir. Taking your expertise to a clinic in Africa, and
Yes.
in
Wonderful.
time that
Wonderful.
will change healthcare, sir, cross-border healthcare. Thanks
Absolutely.
for your time, sir.
Absolutely. Thank you so much. Thank you so much, everyone. I'm really obliged and very happy to interact with all of you. Thank you, Varun, for a wonderful initiative. I'm really happy that someone is thinking on these lines. and making healthcare ease out, rather than more complex. Thank you so much.
Thank you so much.
Thank you, Mr.
thank you,
Muniga. Thank
docteur.
you.
Donc, merci à vous, merci pour votre attention, merci pour tous. À bientôt. Au revoir.
Yeah, Vinegar, please, whatever conversation Dr. Archit and I had, please translate to the French audience.
All right. Let me summarize it. OK, donc, il y a eu un échange
Can we
entre
have
le
this in
docteur.
our email posted?